As the name reveals, underactive thyroid or hypothyroidism happens when your thyroid gland does not produce enough amount of hormone to keep the body running normally. Thyroid hormone, also known as thyroxine, is a vital actor in normal metabolism, growth and development of various organs including the brain and skeleton. Since thyroxine is crucial for normal mental and brain development, any baby with underactive thyroid must be diagnosed and treated with artificial thyroxine or levothyroxine as soon as possible. If left untreated, hypothyroidism can cause irreversible mental and intellectual disability in affected babies. In a nutshell, this disease is currently considered as one of the most preventable causes of intellectual disabilities worldwide. Thankfully, there are 9 relatively specific signs and symptoms that let us suspect hypothyroidism and look for medical care immediately. The earliest sign is jaundice, which causes yellowish staining of skin and eyes. It happens when there is too much bilirubin in the bloodstream. Of course, it's very common for breastfeeding infants to develop jaundice. So, not every baby with jaundice has hypothyroidism. Only in case of prolonged jaundice consider hypothyroidism and seek medical attention immediately. Prolonged jaundice is commonly defined as a jaundice lasting longer than 2 weeks. Next is hypersomnia or sleeping longer than usual. Human body has a 24-hour cycle known as circadian rhythm, which is regulated by the brain, specifically the hypothalamus area. Circadian rhythm plays a crucial role in normal sleep pattern and sleep quality through regulating melatonin production, a hormone that makes you sleepy. In addition to melatonin, hypothalamus area regulates other hormones including thyroid-stimulating hormone or thyrotropin. This hormone is responsible for regulating thyroid function. Hypothyroidism simply interferes thyrotropin production and even the circadian rhythm, disrupting normal sleep pattern and causing sleep disorders. Before going through the rest of the video, if you found this video informative, please like it, smash the subscribe button, and ring the bell to get notified when new episodes are released. Constipation and floppy muscle tone are 2 symptoms being induced by hypothyroidism as well. Their common feature is that both of them reflect slowing of body metabolism due to shortage of thyroid hormone. When body metabolism starts slowing down, muscle cells cannot contract and produce movement normally. So, both bowel motility and skeletal muscle tone become weak, causing constipation and floppy baby respectively. Cool, pale and dry skin is another common symptom. That's because lack of thyroxine impairs capillary flow, sweating, and heat production. As such, decreased capillary flow induces skin pallor, decreased sweating causes dry skin or xeroderma, and finally, decreased heat production leads to cool skin. Other symptoms include puffy face and large swollen tongue known as macroglossia. Mucopolysaccharides are long chains of sugar molecules with hygroscopic nature, that are mainly found in connective tissues. Its hygroscopic property allows it to swell to 1,000 times its dry weight when hydrated. Studies have shown that in underactive thyroid, mucopolysaccharides, notably hyaluronic acid, tend to build up in various tissues including skin and tongue, causing them to swell and become larger than usual. These changes could explain why hypothyroidism can induce macroglossia and facial puffiness. Patent fontanelles may be seen in hypothyroidism as well. As mentioned earlier, thyroid hormone is essential for normal skeletal development and bone maturation. The natural process of bone formation is known as ossification. When bone tissue doesn't get enough thyroxine, ossification is impaired, resulting in delayed closure of fontanelles and patent skull sutures. The last sign in babies with hypothyroidism is protruding navel due to umbilical hernia with large belly. As the embryo grows in the womb, a tiny opening forms in the abdominal muscles, allowing the umbilical cord to pass through and connect the embryo to placenta. After birth, the umbilical cord is cut, since it's no longer needed, and the opening should close as the baby grows up. Sometimes, these muscles fail to grow and therefore do not meet completely, leaving a small hole. A loop of intestine can bulge out, through the hole between abdominal muscles and form a hernia. Keep in mind that in hypothyroidism, abdominal muscles are generally weak due to lack of energy, resulting in both large belly and development of umbilical hernia in babies. Thanks for your watching. Please let me know the medical issues you are willing to learn. Write them down below in the comments for me. Farewell.